I'm Dr. Miguel Cruz from the Cruz Life Center in Burnsville, North Carolina. And today we're going to talk about carpal tunnel syndrome. And we're also going to spend just a little bit of time on some ergonomics that's going to help prevent that in the first place. So what carpal tunnel syndrome is, people often will present with pain in their hand and their wrist. Could be numbness, could be tingling, could be prickly sensations or weakness. The pain can spread into the forearms, elbow, even the upper arm, going into the shoulder, the muscles around the neck, and into the neck itself. It can be very debilitating when people let it go for weeks, months, even years. Often folks will come in to see me when they finally get to the point, they'll say, you know, Doc, when I couldn't pick up my coffee cup, I knew it was time to do something about it. So what often, unfortunately, people do is they'll choose to go the surgical route. What they do in surgery is they will have an incision along the wrist here. What's happening is there's nerves passing underneath a band right there. So they'll cut the band, take the nerve, put it on top, and sew it back up. And if the problem is 100% coming from the wrist, that surgery does work. Unfortunately, there's what's called a double crush syndrome, where the problem is partially in the wrist, but there's also other issues along the nerve higher up, usually somewhere around in the neck area. So when that's the case, then the surgery is just temporary at best, often just a little bit of relief. Those are the ones that I usually end up seeing. So let me show you on some models here. What we have right here is a model of the neck, and the red areas that you see there represent the muscles. What we see here, the yellow, represents nerves that coming out, and we're looking at this area of your neck right here. And what will happen is these nerves, or excuse me, these muscles, if they get tense, they can actually compress and impinge on these nerves here, which will send pain, numbness, tingling, whatever, going down the arm. We call this the shoulder impingement syndrome. And these are the people that are usually carry all their stress up here. They're always uptight, and they're the ones that are usually going to get this issue. By the way, that's very correctable, okay? So there's treatments for that. But the other problem is when the problem's actually coming from the neck bones themselves. The disc in your spine can be inflamed for a lot of different reasons, and that inflammation can be putting pressure on that nerve. You've all heard the term of a pinched nerve, and that could be creating the problem. Once that nerve gets irritated, it becomes more likely to be irritated anywhere along the course all the way down into the wrist area. I'm going to show you an example of that on the computer behind me. So what we're looking at here is a front view of the skeleton right over here, and then here's a side view and showing organs. So what I'm doing here is with my mouse, I am clicking on the different vertebrae. Here is C5, C6, which is the sixth cervical vertebrae, the seventh cervical vertebrae, and the first thoracic vertebrae. Notice on this model here, showing you where the pain, the numbness, the tingling can take effect. Basically where that person's going to have symptoms if that nerve is being irritated. Over here on the right, keep in mind, those nerves are going to organs as well. So we're not just dealing with a spine problem that's causing pain, we're dealing with something that can create other health issues as well. So from a chiropractic standpoint, we evaluate to see if there's a problem in the area of the spine right there, and to see if there can be some correction done. We'll talk about correction and the treatments here in just a second. Next, we're going to be looking at what happens in the disc. Here we see two vertebrae. The disc is here in the middle. The yellow is the nerve. And if there's an alignment issue or some damage in there, that disc will swell, put pressure on that nerve, causing some irritation. Over time, If it's ignored, the problem just gets worse and it gets worse. Another issue, some people will choose to have surgery done for that. What happens, they'll fuse that. That area may not give you any more trouble, but what happens is the area above is going to be the next place to create some issues. That's why when people have a surgery in their back or their neck, it's usually how many more are they going to need. Okay, so let's discuss some treatment options. In our office, when it comes to the carpal tunnel issues themselves, low-level laser therapy works fabulous, and it has been clinically proven to help in these situations, keeps people from having surgery. What the laser does, basically a light pad that will be placed over the area of pain, and it has been clinically shown that the light, specific frequencies of light, will shrink the areas of inflammation, take the pressure off those nerves, and actually causes a healing effect to take place. So the effects can be often very dramatic. Doesn't take long to see if it's working or not. Had great results with that. If the problem is a double crush syndrome, then we'll use the laser over the areas of the neck, of course, but sometimes chiropractic care is necessary in order to relieve any irritation that's going on in the spine as well. We use adjustments that are very gentle using an instrument. So most patients get excellent results with that, and it actually feels good for them. So lastly, what I want to talk about is some ergonomics here. And I'm going to demonstrate on the desk that I have behind me. Now, when it comes to the ergonomics, it's about being comfortable. So you'll notice with the computer that I have behind me here, the screen is right in front of me. I'm not looking up, I'm not looking down. So that's a critical, important thing. The keyboard is also right in front of me, and I'm not reaching for it down, I'm not going way up high, and I'm definitely not looking at anything to the side. I often see people that they are doing this number. Their screen's way out here somewhere and they're on the keyboard. You're just looking for problems. Last thing here you need to look at is your mouse placement. Now, if you'll notice here, I will use my mouse like this. I've got my elbow rested on this table right here. Now, I don't spend a lot of time on the computer here. I'm usually here for a minute or two at a time, just making a couple of notes. But at my home, I have a suitable chair with armrests, and I'm able to rest my elbow while I'm using the mouse. If you're hanging your elbow out in midair, I guarantee you probably have a lot of tension in this area and in your neck or even down your arm if you're on the computer a whole lot. So that's one area you need to fix that. Figure out some way to get that elbow rested there for you, okay? And then I'm going to show you this. I just love this desk that I have here. I bought this desk. Buck Stove Corporation in Spruce Pine, North Carolina makes this. This is a stand-up, sit-down desk, and it's electric, so I'm not having to mess with it as far as fighting to get it up and down. I have it in the sitting position right now. A couple of clicks, and it's going to go up for me. And now I'm in a stand-up position. So I can go back and forth during the day. If I'm not spending a lot of time on the computer, so it's not a big deal for me, but I know some of you all are on the computer all day long at home or at work, and one of these would be an excellent investment. So that's all we've got for today. I hope this has been helpful. Give us a call if you're having any problems with carpal tunnel. We've got the answers for you. Thank you and God bless.